We know that spending time outside, is one of the best ways we can enjoy the warm weather, stay healthy, but there's all those extra health concerns you got to think about, right? Including insects and bug bites and the diseases that they might pass along, which doesn't always feel like the biggest pressure point here in Colorado, right? Because of our insects here versus other parts of the country, but it's something we want to talk about and just make you aware of. So today we're going to talk specifically about Lyme disease, and joining me to help break down the information and the risks, we've got ER nurse practitioner and director of the ER at HCA HealthONE Swedish, Morgan Jared. Thanks for coming.
Thank you for the invitation.
I feel like ticks are not as common here as other places, but they're not totally absent in Colorado, right?
Yeah, that's absolutely correct.
Okay.
And Lyme disease specifically is super predominant in the Midwest and in the Northeast, where there's a lot of deer ticks. The deer tick is what specifically carries Lyme disease. And while there is some instances of it out here, it's large enough that we should all be prepared and be aware. And if you know what you're looking for, Lyme disease is very preventable and you can catch it super early.
Okay, so real basics on Lyme disease. Preventable, can be caught early.
Yes.
What is happening between the tick, the bite, and me that's creating that problem? What's going on?
Yep, so the best way to prevent Lyme disease is to identify a tick bite early.
Okay.
So if you're spending time outdoors, you go on long hikes, you're doing all of those things, highly recommend that you do a quick once over in all the cracks and crevices and make sure there's not one hiding somewhere. It takes a tick about 36 to 72 hours after it has latched onto you to actually bring the bacteria that will cause Lyme disease.
So you have time.
You have time.
Okay.
You have time. And tick removal is a big part of the process. So there's a lot of wives' tales about burning off the tick, using jelly, fine tip tweezers. Get fine tip tweezers, make sure that you get the entirety of the tick and take it off. And then if you accomplish that quickly, you should be fine. Things for you to look for in the event that you did contract Lyme disease is a classic bullseye rash. If you've never seen it before, a quick search can show you what that looks like.
Okay.
And about 70 to 80% of cases will have that bullseye rash on presentation.
And will it be right where the bite was, or could it be anywhere on the body?
It can be anywhere.
Interesting. Okay, let's go back to removing the tick, because that, I know you work in healthcare, so that's fine, but I remember having to do that one time, like in a really tough spot by myself, had someone help me. Like, is there a mechanism? How do you know you got it all out? Is there a strategy to getting that tick off your body?
So if there's nothing visible, i.e. grab the tick by the head and remove at that point, then you're in the clear. Having a friend and somebody help you is the best way to get it done, especially if it's in a sneaky spot. Okay,
good to know. What are some of the, so unfortunately, people aren't gonna always catch this in time. Your body is developing this Lyme disease issue. What are some of you said the bullseye is a sign. What are some of the problems that it's causing?
Yeah, fever, fatigue, really febrile illness type symptoms, malaise, just really struggling to get your normal tasks done would be a visit to a PCP, right? HealthONE, we've got sites all over the city for people to come present for primary care and get into a system. There's other systems that can do the same thing, but your primary care provider can run the tests to see whether or not you've contracted Lyme disease.
Can you do anything once you have it?
You can.
Okay, it's treatable.
It is.
Okay.
So if you catch it early, antibiotics, we've got antibiotics that have been here for many, many decades that treat Lyme disease very easily. It's a longer regimen, so typically 21 days, so 3 weeks, which is on the longer side of receiving antibiotics, and then regularly visiting your PCP to make sure that you have completely cleared the disease. But it is caused by a bacteria, so antibiotics are the treatment.
Okay, that's good to know. It also sounds like a lot of this has to do with not only preventative care, but then once you have a problem, hustle.
Yeah.
God forbid someone doesn't hustle. What are the long-term impacts of dealing with Lyme disease?
Yeah, I think that if you make it to a place where you get identified and then you get treated, that the long-term effects are, there's subjective information as to whether or not long-term Lyme disease is a thing. There are some studies that support it, and it's more of that general illness, fatigue, malaise.
Nobody wants that, of course.
They don't. So be proactive. Make sure that you're checking yourself whenever you come from the outdoors. If you are an avid outdoors person, you can treat your clothes with a permethrin spray, which will help keep the ticks away, right? It's just like putting on insect repellent. I know we don't do that a ton here in Colorado, to your point, but if you're outdoors a lot, that's a great way to.
People travel. It's not always just Colorado. So, okay. All right, Morgan, thanks for all this information. Good stuff about Lyme disease. Be careful out there. There's many ways you can hurt yourself in the outdoors. So let's not let this be one of them.
Yeah, appreciate you and your time.
Have a good summer.
Thank you.
In the outdoors
You as well.
here in Colorado.